11. What is the primary focus of community health nursing? A. Individual care. B. Family care. C. Population-based care. D. Hospital-based care. Answer. C. Population-based care. Explanation. Community health nursing focuses on promoting, preserving, and maintaining the health of individuals, families, and groups in the community. It aims to improve the health status of the entire community by implementing population-based interventions and strategies. 12. What is the main goal of a community health nurse in conducting a community health assessment? A. To identify the health needs of individuals and families. B. To provide primary care services to individuals and families. C. To plan and implement health programs and interventions. D. To evaluate the effectiveness of health programs and interventions. Answer. A. To identify the health needs of individuals and families. Explanation. Community health assessments are conducted by community health nurses to identify the health needs of individuals and families in the community. The data gathered from the assessment is used to plan and implement health programs and interventions that address the identified health needs. 13. Which of the following is an example of a primary prevention activity in community health nursing? A. Administering vaccinations to prevent the spread of infectious diseases. B. Conducting health screenings for early detection and treatment of diseases. C. Providing wound care to prevent infection. D. Educating individuals on healthy lifestyle choices. Answer. D. Educating individuals on healthy lifestyle choices. Explanation. Primary prevention activities in community health nursing aim to prevent the occurrence of disease or injury by promoting healthy behaviors and lifestyles. Examples of primary prevention activities include health education, immunizations, and environmental interventions. 14. Which of the following is a core function of a community health nurse? A. Providing direct care to patients in hospitals. B. Advocating for policy changes to improve public health. C. Conducting research to develop new healthcare interventions. D. Providing education and counseling to individuals and families. Answer. D. Providing education and counseling to individuals and families. Explanation. The core function of a community health nurse is to provide education and counseling to individuals and families on health promotion, disease prevention, and management of health problems. Other core functions include assessment, planning, implementation, and evaluation of population-based health interventions. 15. What is the primary purpose of a community health nurse in conducting home visits? A. To provide medical treatment to individuals with acute illnesses. B. To identify health needs and provide health education to individuals and families. C. To monitor the effectiveness of health programs and interventions. D. To evaluate the quality of care provided by other healthcare professionals. Answer. B. To identify health needs and provide health education to individuals and families. Explanation. Home visits are an important aspect of community health nursing. The primary purpose of home visits is to identify the health needs of individuals and families in their own environment and provide health education and counseling that is tailored to their specific needs. 16. Which of the following is a key principle of community-based participatory research? A. Researchers should have complete control over the research process. B. Community members should be viewed as passive research subjects. C. Community members should be involved in all stages of the research process. D. Research findings should not be shared with the community. Answer. C. Community members should be involved in all stages of the research process. Explanation. Community-based participatory research is a collaborative approach to research that involves the active participation of community members in all stages of the research process. This approach recognizes the expertise and knowledge of community members and aims to develop research that is relevant and meaningful to the community. 17. Which of the following is an example of a secondary prevention activity in community health nursing? A. Providing education on healthy eating to promote weight loss. B. Administering medication to manage blood pressure. C. Conducting mammography screening to detect breast cancer. D. providing housing and transportation for individuals with chronic illnesses. Answer. C. Conducting mammography screening to detect breast cancer. Explanation. Secondary prevention activities in community health nursing aim to detect and treat health problems in their early stages to prevent further complications. Examples of secondary prevention activities include health screenings, early detection and treatment of diseases, and medication management. 18. What is the primary goal of a community health nurse in providing disaster management services? A. To provide emergency medical care to disaster victims. B. To prevent the occurrence of natural disasters. C. To minimize the impact of disasters on individuals and communities. D. To provide long-term rehabilitation services to disaster victims. Answer. C. To minimize the impact of disasters on individuals and communities. Explanation. Community health nurses play an important role in disaster management by providing emergency care, coordinating resources, and minimizing the impact of disasters on individuals and communities. The primary goal is to prevent the loss of life and minimize the physical, emotional, and social impact of disasters on affected individuals and communities. 19. Which of the following is a key component of a community health improvement plan? A. A list of healthcare providers in the community. B. A timeline for completing all planned interventions. C. An assessment of the community's health needs. D. A budget for implementing all planned interventions. Answer. C. An assessment of the community's health needs. Explanation. Community health improvement plans are developed by community health nurses and other healthcare professionals to address the health needs of the community. A key component of the plan is an assessment of the community's health needs, which is used to develop specific interventions and strategies to improve the health of the community. 20. Which of the following is an example of a primary prevention activity in community health nursing? A. Administering vaccinations to prevent the spread of infectious diseases. B. Providing rehabilitation services to individuals with disabilities. C. Educating individuals with chronic illnesses on disease management. D. Providing end-of-life care to individuals with terminal illnesses. Answer. A. Administering vaccinations to prevent the spread of infectious diseases. Explanation. Primary prevention activities in community health nursing aim to prevent the occurrence of health problems before they happen. Examples of primary prevention activities include immunizations, health education and promotion, and environmental assessments to prevent health hazards. Administering vaccinations to prevent the spread of infectious diseases is an example of primary prevention activity in community health nursing. Thanks for watching.